Hi, everyone. Thank you so much for taking the time to speak with us today. We're here with Why We Vaccinate, a nonprofit organization dedicated to providing scientific information about the value of vaccines and also combating myths and disinformation. We're here with three incredible physicians who've spent their careers in the trenches of public health, particularly fighting with infectious diseases and working on communicating science with compassion. Let's start with some brief introductions. Could each of you share a bit about who you are and what brought you to this work? Perhaps we'll start with Dr. Luber.
Uh, My name's Stephen Luber. I went to the University of California, San Francisco Medical School and did my residency there in pediatrics. I'm a board certified pediatrician and a fellow of the American Academy of Pediatrics. I trained a long time ago, and we saw back then a lot of infectious diseases that fortunately we don't have to deal with today because of vaccinations. But it was a good tutorial. I then went to Central Idaho, where I was literally the only pediatrician for 100 miles in any direction. So I got referred a lot of very sick children and got to deal with sick children and complications, and frankly, a lot of illnesses that we don't see today because of vaccination. After 18 years of being on call 24/7, I moved to the University of Washington and taught pediatrics in the WWAMI program and began doing a lot of clinical trials. And as such, I performed over 60 clinical trials in the areas of infectious diseases, including most of the common vaccinations, and timely, including the MMR and the MMRV and recalibration of the MMR. That was done in 2010. I had just recently retired. I've been doing public health volunteer work, which includes vaccinations. I'm very concerned about the dismantling of our public health system at the current time and the emergence of popular choice as opposed to universal vaccination.
Thank you so much, Dr. Luber. And we appreciate that color. Dr. Miller?
Thanks. Yeah, I'm Mike Miller, and I've spent most of my career actually doing health policy, communications, and advocacy. Most of that in Washington, D.C., where I worked in the Reagan-Bush White House, the NIH, the United States Senate, Congress, big biopharma companies, and over the years, my work has evolved to be more around with working with patient advocacy groups and other kind of clinician groups and community groups. And the common theme has been trying to promote awareness, understanding of access, affordability, and particularly innovation. And throughout that, I've been involved with trying to communicate information about health and science to non-experts, the lay public, which by definition legislatures and policy people in Washington often are. And during the pandemic, I joined the board of Why We Vax at the beginning of the pandemic. I continue to manage their SAB and have really focused the last 5 years on vaccine misinformation and confidence, and wrote a book earlier this year, which we'll talk about a little later, I hope. On to you, Vivian.
Great, thank you. Appreciate this opportunity to be here. My name is Vivian Huang. I'm a dual trained physician. I am trained in internal medicine and public health. For the last close to 20 years, I've done mainly work in public health, and my specialties really and my passion lie in vaccinations. I have spent time working as a physician for Doctors Without Borders and also Partners in Health. I responded to the 2015 Ebola outbreak, which still is the largest Ebola outbreak on record. And while I was there was a measles outbreak. I have also spent time working for Doctors Without Borders in Syria, and we also carried out large vaccination campaigns in Syria during the civil war there. Throughout most of my life, vaccinations have been really an important part, not only of my professional career, but also my personal life, and which we will probably get into a little bit more during this conversation. I'm a strong advocate of vaccinations and prevention, and will continue to advocate for vaccinations. I currently work for a vaccine company, and I'm the I'm the medical director for flu and COVID vaccines. So great to be here. Thank you.
Thank you very much for that background and some of your personal histories. And agree, Dr. Huang, it's useful to anchor with some personal stories. So maybe I'll hand it back to you. I remember you told us a story about how I believe your aunt had contracted polio in Taiwan during your childhood. Would love to hear a little bit about how that disease impacted your family and how it shaped your commitment to vaccination.
So thank you again, Sia, for giving me this opportunity to speak. And I'll just share a little bit that very early on in my life, vaccine-preventable diseases touched my family. So the year was 1957, and my aunt, who is my mother's sister in Taiwan, contracted polio. Now, Salk had already developed the polio vaccine in the US. However, this vaccine was not available yet in Taiwan. And because of this, my aunt was unfortunate and unlucky and contracted polio just about the time when she was walking. Um, it was incredibly devastating for our family because she currently now can't walk anymore. So she had just learned to walk, and then because of polio, could never walk properly anymore. The other piece of all of this is she does have complications from it. She has left lower leg paralysis, but at the time in Taiwan, there were not many people making prosthesis or special equipment for people who had disabilities. So it was really hard on our family to constantly try to find companies and doctors that could help her. And then I remember this one story that my mother told me is that my mother would carry my aunt on her back to get her to school. And then one afternoon, when they were both coming back from school, my mother slipped and they both fell into a river, and they both were injured and got wet. And so I remember this story because my mom still continues to tell it. So, polio has affected our whole lives. My mother had to especially take care of my aunt. My aunt constantly had medical challenges, and it was really devastating. So I think when you see firsthand something like polio affecting your own family, and what that can do, and the devastation it causes, it really changes how you feel about vaccination and how important vaccination is to protect the people you love in your family. Yeah, so that shaped me from a very young age. Yeah,
Thank you
thank
for
you.
that. Yeah, we have this perception that these diseases are so far removed, but a lot of us, particularly those whose families came from other countries or those of us who did, have these stories of our grandparents or our, great uncles and aunts who suffered from this. It's not that far removed. So, thanks for that. Dr. Luber, I remember a personal story that you had shared about a very famous family and family member who you had treated in your lifetime. Do you mind sharing a bit about that story and how it reflects the fact that, infections and vaccine preventable diseases affect everyone, regardless of privilege or politics?
I would like to add, and hearing Vivian, I grew up in the 40s and 50s, and I remember the absolute fear that pervaded our families about polio. We couldn't go to the park. They didn't want us to go swimming at the community pool. And there was literally a child on every other block with polio. And the local National Guard armory was filled with the old iron lungs because they couldn't accommodate all the kids who needed it in the hospitals. And the absolute relief of that fear that came with the Salk vaccine at that time was palpable. And I think it really highlights, in conjunction with what you were talking about, the really devastating nature of these illnesses we're talking about. I was working in a resort community, Sun Valley, Idaho, and the Kennedys used to vacation there. And I saw one of the members of the family for an infectious disease. And that night, when we had the old telephone on the wall with the long cord that you had to dial, and my wife picked it up and said, "Stephen, there's a woman who says she's Ethel Kennedy on the phone. Will you please deal with this?" And I said, "I hate to tell you, but there's a substantive chance that it is Ethel Kennedy." And she announced out of the speaker of the telephone, "This is Ethel Kennedy." But she brought in the rest of the family for appropriate prophylactic measures to prevent the spread of the illness. And it was the illness did not respect social station, economic status. These illnesses did not pick and choose about who they infected. But then we routinely applied the measures that now seem to be in question. With vaccinations, there was no personal freedom that you hear about now, where the parent is free to choose whether the child's immunized. Back then, we all had to be immunized because we knew we had to protect everyone around us. And that you're not just protecting that person, but you're preventing epidemics within your own community.
It's a great point when we think about the community and protecting others. So thank you for ending on that point. Dr. Miller, you've worked in science policy and industry, and now, as you mentioned earlier, you've authored a book. What made you write it at this point in your career, and who do you hope it gets to?
Well, thanks, Sia. As you know, I shifted my work focus to vaccine confidence and misinformation, which led me to join the board of Why We Vax for a year and stuff. But early on in the pandemic, 2020, late 2020 into 21, 22, friends and family were asking me, because they knew I'd worked in health science and communications for a long time. They were asking me, how do they respond? How do they talk with their friends, their family members, people they work with, who were spouting misinformation about vaccines or COVID or related things? And I searched around all the organizations I'd worked with or knew about, couldn't find anything, really digestible and practical to provide them, but this is what you do. So that's when I started to think I need to write this book. I can hold it up. Hopefully Zoom helps. Reversing misinformation, how to help your family, friends, and community. And the case studies are vaccines and COVID, but also gets in a little bit about elections and climate change. And I wrote the book for them, my friends, family, and everybody like them, because it's clear that there's a large population of people who are struggling with this and they don't know how to respond. And it's not a book about how to talk with these people, not at them, not correct them. And it can result in things over the long term of getting those people who are misinformed to loosen their grip on their misinformation. So they end up doing things like getting vaccinated or supporting public health measures. And the end result is better relationships between people who may have had different perspectives, if you will, about things like vaccines, and also stronger communities and ultimately stronger economy and better national security. Something else we can talk about, because I think one of the lessons of the pandemic is if we have a infection spreading across the community, it hurts the economy. Businesses know if their employees can't come to work or can't be productive, that hurts the business. And as we've seen, it hurts national security. We've seen this with diabetes and obesity, where the military can't, even get recruits who are fit. And I can go on, but I'll leave it at that. See, can I also comment around something that Stephen Luber mentioned about, the medical freedom
Yeah.
construct? Because there's this the percentage of people who are vaccine questioning, sort of pre-COVID's gone from about 1 to 3% to now about 15%. And there was recently an article I read that described a large cohort of those 15% as the MAHA moms, or the people who are supporting this Make America Healthy Again construct. And they divide into three groups. First group is people who have fear of vaccines or fear of medical interventions because they have a sick child who has some, illness, that chronic illness, could be autism, could be a lot of other things. Oh, and by the way, the CDC report yesterday showed that we don't really have an increase in autism rate. We have an increase in diagnosis of autism because of awareness and better screening. So that first group, they have fear, and they run the political spectrum. The second group is sort of the natural, healthy, or what's called crunchy group. They really think that, everything should be, natural, this and that. And they tend to be left-leaning. They represent sort of a remnant of the pre-COVID vaccine questioning or resistant group. And then the third group is, I think what Steve alluded to, the medical freedom movement, when they tend to be more right-leaning politically. They have a strong sense of autonomy about I get to choose and everything else. So the first group, spectrum, they've got mistrust. The natural group, left-leaning, maybe more little autonomy, a little mistrust of biopharma and everything, and then the other. So it's a big spectrum of people. You can't just box these people into one category, and that's just the mom group. There's others that we can talk about later if you want.
That's a
So thanks
great
for
point.
letting-
Thank you for that. I think even as somebody, I've worked in the vaccines industry, but I'm not a public health expert. I'm not a health communicator per se. But I know this is the right thing to do. And it's so hard to talk to family and friends, even those closest to you. It's just hard to break through and translate. So the work you're doing is critical. And your points on meeting people where they are with respect to their particular concerns is also something that I think we could all do better with.
You talk with them, not at them. You can't
Yeah.
correct them. You got to listen to them.
Yeah. Um, so I think we'll circle back to that, these ideas around kind of empathy and community. I would love to take a little bit of time. We talked about the devastation that polio caused, even in recent memories in some of our lives, our families' lives. We don't know much, at least I don't personally, about rubella, mumps, measles. So Stephen, you treated rubella and mumps in the past, actually. Do you mind explaining in simplest terms, what does rubella do during pregnancy and why is the timing of infection really dangerous? How does it cause then congenital rubella syndrome? What does that look like?
Well, I think you're bringing up the fact that when you oppose measles vaccination, you forget that it's the MMR vaccine, measles, mumps, and rubella. Rubella doesn't leave the person who has it sick at all, or maybe they might notice not feeling so well with a mild fever. But if you are a woman in the first trimester of pregnancy, your child will be damaged. What exactly is damaged is dependent on when in that first trimester you had the virus running through your bloodstream. And we would see large number of kids who were born deaf, who were born blind, who had major cardiac abnormalities on a not uncommon basis. And that went away when we started using MMR. Mumps, everyone knows about the swollen jaw, but also causes the gonads to swell. For a woman, not a big problem. Your ovary is designed to swell, does it every month. But for men, it's not designed to swell. And if you were involuntarily sterile in the 1950s or 60s, you by definition had mumps as a child. And it was the largest cause of male sterility that was commonly looked at. And I think it emphasizes that the illnesses that we see don't see anymore, that the pediatricians aren't trained in. I saw a kid with chickenpox who had encephalitis from chickenpox. There's no treatment for it. And the parents grew up not as fearful as our parents did because of polio vaccine, but they grew up scared of a lot of vaccines. And you could see the relief when a meningitis vaccine came out, when a rotavirus vaccine came out. The parents embraced them. There was almost no fear, and they were just relieved to have something to take one more fear of raising a child off their head.
That's right. We have enough to worry about. And we always say
I
vaccine.
can't hear you.
Oh, I just nodding in agreement, Dr. Luber, that parents have enough to worry about. And so not losing your children or having your children be ill due to these infections is one of the greatest achievements of humanity, I would argue. So Thank you for that. I also remember, Vivian, you talked about the Ebola outbreak that you were involved in when you were giving your introduction. But you had said you encountered measles during the Ebola outbreak, and it was, I believe it was you who were one of the few to identify it. Do you mind giving a bit more color on that story and then what measles actually does to your immune system and why it's so dangerous?
Yeah, absolutely. So back in 2015, I went with Partners in Health to respond to the Ebola outbreak in West Africa. And as many of you may remember, this outbreak made world news, and everybody learned about it. And globally, many public health experts and physicians came to respond. So I came to Sierra Leone thinking I was mainly going to be responding to Ebola, but what happened was because there was such an emergency with Ebola, and that all health systems basically had to respond to this devastating disease, that a lot of other health programs couldn't actually run as normal. So, for example, many of the physicians from the medical schools were pulled to work on Ebola response. All the nurses, all the health care providers in the country all had to be pulled to respond to Ebola. And as a consequence of that, routine immunization programs had to stop. There was nobody running those routine immunization programs. There were no clinics open. And as a result of that, while we were all responding to Ebola, we started to see babies with rashes, and we weren't sure what was going on, but because schools were closed, clinics were closed, nobody was really getting any routine medical care. Our team started to have suspicion for measles. And I remember going out with a team of WHO doctors and myself with Partners in Health. And I saw a baby and I thought, this is probably measles. There is there is a medical term called Koplik spot, which is like a blue ring that you can see sometimes. That's in the buccal or in the mouth of the baby, and I was able to see that, and I thought this has got to be measles. And what we did, which was really fantastic, is that the Dutch government had sent a lab to the Ebola response, and they were working out of containers, basically, right? One of those containers, and they were initially only testing for Ebola, but because I had developed a friendship with the Dutch physician, I said, I think this is measles. And she's like, I think so too. And I said, would you be willing to swab the baby and check to see if it's measles? And ultimately we found measles. So when you have one devastating disease compounded by another illness, it really speaks to really how important vaccinations are. Now, I'll say at the time that when I was in Sierra Leone, an Ebola vaccine was not available, but because of that outbreak, studies were able to be carried out in that setting. And so we now also have Ebola vaccine, 100% vaccine efficacy against Ebola. But I think the importance here is that while we did find measles, I would say that, not all measles is benign. I think a lot of people commonly feel like, oh, it's just, a rash, and maybe the baby might have some upper respiratory, kind of symptoms like a mild cold. But that's not entirely the case. There are a couple of complications that can happen that people may not be as aware of, and one being subsclerosing panencephalitis, which is a rare outcome of measles, but does lead to mortality. So it can actually come on 7 to 10 years after someone has been infected with measles, and then they die from encephalitis. So it's a rare condition, but why put your child in harm's way and having that uncertainty that they may actually die of something very rare. Can you imagine being a mother and having a child pass because of an encephalitis, something from, a while ago from a measles infection? So that's one thing I wanted to highlight. But the second thing is that we're also learning too, from some of the researchers that work on measles, is that when you do get infected with measles, it seems to wipe out your immune cells and your immune memory and the ability to actually fight other infections. Now, initially, they thought this was very short-lived, for a couple of weeks, but more research is being done, and it seems that this type of immune amnesia, as they call it, seems to last for 2 to 3 years. And so there's a researcher by the name of Michael Mina who's out of Harvard, and he's been doing some of this research. And it seems like the measles virus likes to latch onto the memory cells, our immune memory cells, and just wipes out our ability to have a normal immune system for our children. So I think with those two complications, which isn't often talked about, I think it's not to put fear into people, but there are serious consequences of getting these infections. Why get an infection when there is a vaccine that's available to prevent it? So I think, by telling the story of, my time in West Africa responding to Ebola, at the same time finding measles, and then with also these medical sequelae and complications later, long term, I think there's a lot of value to vaccinations and a lot of value to prevention. So just really wanted to share my experience and also just some of that, just some of the medical pieces of this that aren't always talked about. So yeah, thank you.
Thank you.
Vivian, just want to clarify, the sclerosing encephalitis comes on years later, but kids with measles can die acutely because we've had a couple of deaths in Texas in the current large outbreak of 600 people. So it's not only the risk of death long term, it can happen acutely as well, right?
Absolutely, absolutely.
Okay.
Yes, absolutely. We've already had two pediatric deaths and actually one adult death in this current measles outbreak that has exploded to over 700 plus cases in 25 states. Absolutely, Michael.
You have to view that, remembering that in 2000, measles was considered eradicated in the continental United States. I once got called to look at a group in central Washington who had measles, and I was the expert because I'd seen one case. And I had him, of course, I had him myself growing up, and I remember being quite sick with it. And people were scared of the encephalitis because they kept us in dark rooms and we couldn't listen to music or watch TV while we were ill because they were afraid this would stimulate the deafness or blindness. It was not true, but that's what was common knowledge at that time. So measles is not trivial, and as you know, the most infectious of all the illnesses that we run into. Each person will generally infect 19 others, and doesn't require a whole lot of contact around them or even on surfaces to get measles. So you are dependent on the herd immunity to
Yeah.
control measles.
And
Just to
before,
echo what you were talking about, there have been two developments in our history which have increased the health of the citizens of any country. One is clean water, the other is vaccinations. Everything else is ancillary.
Yeah.
and before the development of the measles vaccine in the early 60s, in the US, there'd be 400,000 to 500,000 cases of measles every year. And now it's down to 2000 was zero and it's bounced around, except years like this year when we're heading towards several thousands again because of lack of immunization.
It will be endemic.
Yeah. We've already had new outbreaks in several other states besides Texas and New Mexico that are not
Mhm.
tied to Texas. Anyhow, let's move on, Sia. Sorry.
Yeah, no, I mean it's sobering and fear-inducing, and just listening to it's like two steps forward and then you take steps back, right? And so I think while we're on this topic of fear, we've been talking a lot about these vaccine preventable diseases that are now reemerging sadly. And as Vivian noted, there's an interplay between the two of vaccine preventable and then emerging infectious diseases. I think your story on Ebola and the halting of vaccination shows that everything's kind of happening at once. So it's not enough that we have to worry about these re-emerging infections, but we always have the spectra of emerging infectious diseases and pandemics. And so I would put this out to the group. We've lived through some of this. What's on the horizon now? If you had to sound the alarm, what are you seeing? What would it be in terms of the next major emerging pandemic? What do we think?
I mean, I just want to refer back to something that came up at the beginning of this most recent pandemic, is that the National Security Council at the White House actually created something called the Global Pandemic Playbook in 2016. And there was like a similar documents at HHS and CDC. But that 60-something page book listed all the possible threats. And one of them that was very prominent was novel coronavirus. But it was one amongst many things. And the SARS-CoV-2 virus, which caused COVID, it's not the only novel coronavirus. In the early 2000s, we had SARS-CoV-1, which almost caused the pandemic, had a big outbreak in China and Toronto and a couple other places. But because of public health measures, it got squashed. So it could be a coronavirus, could be another virus, could even be a bacteria.
I would,
Yeah.
And I'll let Stephen and Vivian pontificate more.
when I heard about something like Ebola virus, when I was practicing, it scared me to death. Because there was nothing to do about it, and if it ever got loose in the US, I don't know what would have happened. And you hear this list, as you mentioned, of all these unique and somewhat exotic illnesses. But I swear that the most likely problem for pandemic will be influenza.
Mhm.
Influenza was disastrous in the early part of the 20th century. We are seeing the emergence of bird flu, which is literally one mutation away from being able to go back and forth between humans. And we are woefully unprepared and to either monitor it, identify it, or much less treat it. And we are systematically eliminating the resources we need in the government to either track it, identify it, or treat it.
Well, and Vivian, I'm sorry to jump in again, but
Mhm.
the thing is, and Stephen made this point, I just want to reiterate it. For most of these viral infections, there is no treatment. I mean, we know that about measles, and until they came up with a couple things for SARS-CoV-2 that caused COVID-19, we didn't have anything to treat that. Treatment of viral illnesses has been very symptomatic and not really targeted to any of the illnesses. We've gotten a few in medical science over the last few years, but for most of them, it's just supportive care at this point still.
Yeah, I mean, I would agree with both of you. It's a matter of when versus if. And I think that, Stephen makes a good point. It's likely that we could see another influenza pandemic. It's possible that we could see avian flu, right? The highly pathogenic avian flu. I'll just also comment that, for example, monkeypox, right? Monkeypox, we've known has been in the Congo for some time. However, very recently, about 4 years ago in the US, we saw a monkeypox outbreak in a very specific population. And it somehow was it was more able to transmit via mucosal transmission. And then so we had a huge monkeypox outbreak in our LGBTQ community. And I helped to lead some of those efforts in Phoenix, Arizona. And again, it's a vaccine that really helps to limit the transmission and to end that outbreak. So it was seen in a specific population in Africa, and somehow it made it into a very different population in a very different part of the world, being in high income countries. And so we could think of flu, we could think of avian flu, highly pathogenic avian flu, but we can also think about things that we normally think, oh, it might just be in this other place that's not going to affect where we live. I think something to really remember is, we're a global community, right? We're one plane ride away from something that we think that might be more exotic or foreign, or that couldn't come to the places that we live. And that's just completely untrue. And then if you take in to account, for example, contagious factor, right? Let's say we got something like flu that became more infectious, like, for example, say like measles, then what would you do in that situation, right? So I think viruses are always one step ahead of us. They seem to be much smarter than us, and we don't have the abilities to really treat it. So I think, it's kind of a lesson for us, right, from the pandemic that we really need to strongly prepare for the next one. And vaccines really are the cornerstone to really prevent the next big pandemic that will occur, I think. So yeah.
Yeah, and that globalization, some of those non-traditional U.S. infectious agents are now present in the U.S. because of changes in the environment. You met Zika, I can never pronounce it. Chikungunya.
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 Chikungunya, yeah, southern because of warmer climates. But just to put a little bit of rash sunshine in here, one of the challenges of you mentioned, influenza, and we've seen with SARS-CoV-2, COVID virus, is it keeps evolving and mutating. Not all viruses are the same, and fortunately, measles, the old vaccine, still works because the measles virus doesn't really seem to mutate and evolve. I liken it to the difference between automobiles and trains. Trains are the same as we've had since the 1950s for the most part. Maybe a little better engines, but the train cars haven't changed all that much. Whereas cars keep evolving. And so when people who don't understand science or vaccinology or biology, they go, why don't we just get a cure for all these viruses? There's all sorts of viruses. It's also analogous like cancer. There's all sorts of different kinds of cancer. You can't just treat it as look at it as one thing that science can suddenly solve.
Yeah.
Which is why we need to keep vigilant. And as I said, for things we have vaccines for, we got to keep using them and working on developing new and better ones.
So,
Yeah.
Mike, I like that you mentioned some promising notes. I think that's a good way to start circling up here. So, I think in the last section, we I heard somebody mention SARS-CoV-1 and how public health measures really helped stop that pandemic. So I think it's a powerful reminder that vaccination is one important piece of a even bigger toolkit. And even with, you know, the rapid breakthroughs that we've seen and lived through with respect to biotech, where you can sequence and build a vaccine quicker than ever before, still in the early days of an outbreak, we rely on the critical and sometimes invisible work of public health professionals, right? And that hits close to home. All of us have family members who are nurses, doctors, and other types of professionals. So I would love to end on the role of healthcare workers and the community. Maybe I'll first start with Dr. Luber. You had mentioned that your wife was the lead nurse at a school, I think, and how I remember this from my mom. Nurses were often the defenders of immunization, right? So what can local systems be doing to empower them again to play that important role?
Well, Lori was a pediatric nurse practitioner, and she was lead school nurse for the city of Spokane Public Schools. And at that time, there was a wall at the school. If you were not vaccinated, you didn't go to school. Since that time, there have been expanding numbers of exceptions for religion, personal freedom, and we are now dangerously close to the level of vaccination that's going to permit epidemics to occur. We know that you need to immunize 95% of the children to prevent measles epidemics, and we're down to 82% in the state of Idaho, and we are being followed by many other states. So we are going to have epidemics, and we need to once again empower the public health workers, the school nurses, to emphasize that you need to do this in order to partake in the school system. I don't see that evolving at the current time. I see it devolving, and I'm very concerned about that.
Yeah, we all are.
Yeah.
And you had mentioned something that stayed with me, and it resonated too when I hear the stories and read the stories about your career, which is that vaccination and public health generally is an act of love. So when we think of all of your work and career, I think of community care, not just taking care of ourselves individually, but thinking about the community. So, can you talk a little bit more about, maybe this is to all of you, the idea of collective responsibility and how it shows up in what you do?
Yeah, thanks, Sia, for that. And, I think that the pandemic has, it's been devastating, I think, for a lot of us, and a lot of trauma has happened, and we just are, I think, still really kind of coming out of that, right? And I think a lot of people feel a lot of hurt. A lot of people are sad because they lost people in the pandemic. And I do think that vaccinations and prevention of infectious diseases is really an act of love, because you think about your neighbors, you think about the people that you love, your family, your friends, right? And we know that, for example, with measles, right? This term comes up all the time, herd immunity. If we have a lot of people that are protected, that means we protect those people that are most vulnerable, right? For example, there are people who don't respond to measles vaccines, or there are people who are immunocompromised, right? For example, if people have cancer, or they have leukemia, or they're on immunosuppressive medications, and the vaccines don't work as well for them. So, how do we protect those people that are most vulnerable in our society? I've always come to medicine and public health with that intention of healing and love. And so when you get yourself vaccinated, you're protecting other people. You're protecting yourself, but also your community, and the people that you love. And so that is the message that I like to bring to the work that I do. And so when people tell me they might be, hesitant about vaccines, or they may have questions, maybe they're not, maybe they are interested in getting the vaccine. They just need to understand a little bit more. So coming to it with humility, answering their questions, respecting the other person that's asking the questions, and then really just coming together to help each other, right? So that we can move forward, and make this world a better place. That's truly how I see it. Yeah, thank
Yeah.
you.
Can I chime in there and sort of meld those two issues that Dr. Luber talked about in terms of public health workers and Vivian, the community, and you put it together, get community health. And what I see really we need is it's to get to people, support vaccination rates and support confidence in vaccines, is a combination of trusted messengers in the community who have enough time to engage with people who have a lot of questions. And unfortunately, sometimes people say, "Oh, well, physicians really don't have the time to engage with people," and a lot of times nurses don't. So we got to think a little broader down sort of the pyramid of healthcare, public health workers, whether that's pharmacists, home health aides, other people who are out in the community and can talk to people at length and repeatedly. And I even expand that sphere to things that people don't think about as those who should be engaged in health communications primarily. Uh, the clergy, barbers, hairstylists, they've actually done a lot of good work around diagnosing skin cancer because they're looking at people's heads. But just all sorts of people in the community, coaches, baristas, anybody who can have time to talk to people and are trusted in the community about what the importance of vaccination is, why it's important for the community. And of course, plug my book again. This is for just the ordinary person who's trying to talk to the other people in their community they know. And the existing relationship makes them a trusted messenger. So I think we need to think, downstream about how to foster these communications in an ongoing way, not just one-hit messages. And I know we're quite close to time.
Great.
Thank you.
It's a great point. Those are really great sort of ending things to take away. I know we covered a lot of ground today. I think there could never be enough time actually to cover all of these massive issues that are sort of pervading every aspect of our life and our healthcare. But I really want to thank you all for your stories, the information you shared and your wisdom through decades of work that you've been performing. The challenges we're facing are real, and it's paradoxical because we have all these solutions at the same time on the technological front, on the education and communication front. So I think today reminded us of the power of knowledge, empathy, and community. So I thank you all for your time, and we'll say this is to be continued.
Yeah. Thank you, Sia. Thank you,
Yeah.
Steve,
Pleasure
Vivian.
Yeah.
listening to
Thank you.
Vivian and
Thank you,
her
everyone.
stories.
Yeah.
My word.
Yeah.